What are my priorities as state representative? Number one, supporting our public schools. As a school committee member, I know firsthand the challenges our district face as a result of increasing financial pressure, mounting mandates, and rapid changes in the field of education. As a product of Shrewsbury Schools, I have a passionate commitment to being a strong voice for our districts in both Shrewsbury and Westboro. It's never been more important than in the coming session of the legislature for Shrewsbury and Westboro to have a strong voice in the process with regard to our public schools. The Commonwealth will soon revisit the Chapter 70 formula for providing state funding to our school districts, and communities like ours need to be a part of that conversation to ensure that we're not left out in the cold. I also oppose lifting the cap on charter schools. While there are successful charter programs with which I have no qualms, Shrewsbury and Westboro Public Schools perform very well, and expanding the number of charters is funding taken away from our schools, money out of our pockets, without benefiting our districts or our students in return. And supporting our schools isn't just a necessity for students and parents. Ensuring that we receive the support that we need and deserve from the state will help protect our seniors and those in need from the need to further dip into our local property taxes here at home. Fighting unfunded mandates. As a school committee member, nobody has to tell me about unfunded mandates. I will stand up and say no to unfunded mandates in the House. When something makes sense as a public policy at the state level, we need to provide the resources to back it up, instead of ordering the meal and then sticking the check with our cities and towns. Additionally, I'll push to have mandates which require onerous staff time for compliance recognized as unfunded mandates, and advocate for relaxation of those and financial support as appropriate. Promoting job growth. I'll fight to make sure Central Massachusetts and the 495 corridor are a focus of conversations about spurring economic growth in Massachusetts, in particular as they relate to healthcare, biotechnology, and higher education. Improving access to our state colleges and universities is also, to me, a key part of maintaining our competitive edge for our state and in our region. The cost of college in our public system, even in our community colleges, is getting out of reach due to high fees for many of those looking to retrain for a new career or career advancement, or those looking to enter the workforce for the first time or re-enter the workforce after a long period of unemployment. Protecting family economic stability. I'm for making sure that earned sick time, which passed the ballot box this past fall, not only statewide but also in our district here at home, is implemented the way voters intended, so that families where a working parent is struggling from illness don't face financial ruin. I'm also opposed to new taxes or tax increases at the state level. Families are still struggling as we wait for jobs and wages to recover at the rate that we would like, and I think that we need to reprioritize at the state level in order to support needed new investments. And I'm for a strong minimum wage for every working individual, which we all know lifts our economy and helps stabilize families economically, something that is going to emerge as a key difference in this race. Combating the opiate abuse crisis gripping Massachusetts and the Northeast. Working for Veterans Inc., an agency that, of course, provides mental health services and substance abuse counseling, I have real insight into the serious public health and safety crisis that has gripped the region. I'm a strong supporter of expanding the number of available detox beds as part of helping to address the issue, and supporting innovative programming to bring increased mental health services to the young people supported by our public school districts. I applaud Massachusetts for being one of the first states to require insurers to cover up to 14 days of inpatient detox earlier this year. To me, it is a tragedy whenever somebody in the grip of addiction chooses to get help but is thwarted by an inability to access treatment or other needed services. Failing to address this crisis will cost us as a state in terms of public safety expenses, emergency room care, and stresses on our public school students. I also want to applaud the Attorney General-elect for making this issue a focus of hers, and I'm so pleased to have her support. I'll be an ally of hers in the legislature as she fights to strengthen the prescription monitoring program and ensure that addressing this crisis moves to the forefront where it needs to be.